Wuhan drained of life. Traffic arteries once choked with vehicles swept clean. The city's main train station shuttered and deserted. Checkpoints are everywhere, measuring the temperature of the few drivers still on the streets. This is a city in the grip of a deadly disease. While transport has come to a virtual standstill, these images from social media show hospitals crowded with people desperate to be treated. As the official number of cases keeps rising, Beijing's response has been hands-on. 2 new hospitals are being stamped out of the ground in Wuhan, to be completed in little more than a week. But intervention from the top is likely not enough to stem the spread of the coronavirus. Officials say local efforts are more important than ever.
The epidemic prevention and control efforts are at a critical moment. It is necessary to mobilize grassroots communities, including rural communities. We need to implement blanket tracking and grid-based management and ensure every household and individual fully exercises prevention and control measures.
In a country that is usually managed from up high, the devolution of the disaster response in China is a sign of how serious this public health crisis is.
Joining us now from Geneva is Christian Lindmeier from the UN's World Health Organization. Welcome to you. Now, your Director General is in Beijing today for an emergency meeting on the outbreak. What can we expect from talks there?
So, of course, they're meeting with the whole delegation in order to go over the recent findings and the recent measures and to see what either the World Health Organization is able to assist or to come back with a better knowledge and a better understanding of the disease to inform the world's communities about what's going on in China.
Now, as we heard, there's some 60 million people under virtual lockdown across China, and yet the virus is still spreading. To what extent, then, are the measures taken by China helping?
Well, you have to see that, I mean, with the thousands and thousands of people, as the images show, showing up in hospitals, of course, because this virus presents with flu-like symptoms from mild to very serious, also a cough, a sneeze, fever. But this is very similar to exactly that, the flu or other respiratory syndromes. So many people will go now and seek for clarification or for help at the medical authorities, and they will not have this coronavirus, this novel coronavirus. They will have other diseases or just not much but a scratch in the throat. This is unfortunately what it brings. On the same time, it is very important to look at all these people and to treat them, and also to see which ones are actually infected and which ones are not. The more we are looking, or the more the Chinese authorities will be looking, the more people we will find, most likely. This comes with the nature of it, and this is also good. At the same time, it's important to see that mostly all of the cases that we know so far are clearly related to the outbreak in Wuhan and to either clusters of families and friends or with medical staff infected who were in very close contact with the patient. So the very close contact is still an important thing. It doesn't seem to be spreading. This virus does not seem to be spreading easily elsewhere from human to human.
But your organization decided against declaring an international public health emergency over the virus last week. Is the WHO having second thoughts on that decision?
So the WHO accepted a recommendation by an independent expert committee, which is important because quite a number of scientists and experts were sitting together discussing this. One of the criteria which is interesting here is this international spread. While we do have definitely a crisis in China, and you see the pictures, this is not looking normal at all. So there is a crisis in China and authorities are doing everything. But the international spread is of a crucial question here, the risk to the international sphere. We do see travelers going abroad and bringing the virus with them. But so far, as much as we know, they have been detected by the health system, by the countries, have been isolated, have been treated. The onward transmission from these travelers, that would be an important criteria. So let's say the travel agent, the agent at the airport, the bus driver, the taxi driver, the family members they meet at home, and so on. Once we see such cases being carried onwards, that would be an important criteria to looking at this criteria of international health concern, a public health emergency of international concern. And again, to underline, luckily, we haven't seen that yet.
Christian Lindmeier of the World Health Organization in Geneva, thank you very much for talking to DW.